High-quality programs promote safe and healthy environments where children can thrive and grow. Young children depend upon the adults in their lives to make healthful choices for them and to teach them to make smart choices for themselves. Health policies are guidelines that support you in maintaining a climate of wellness by promoting healthy behaviors and preventing the spread of disease. The policies ensure that safe and appropriate health practices are in place. They also help to guide decision-making about how to manage confusing or difficult situations. All licensed child care programs must have written health policies and procedures that are written in a manner that is clear and easy to understand. Shared with all new staff during orientation. Posted for staff and families to review. Reviewed, signed, and dated by a physician, physician's assistant or registered nurse when you change your policies and procedures or type of care provided. You have read about health policies and procedures in your guides, page 123 to 125 in the Child Care Licensing Guidebook, and sections 5 and 6 in the Family Home Child Care Guide. Do you know what these are and where you can find instructions on how to do them, and read the following list? Provide general cleaning of areas, clean and sanitize equipment, prevent, manage, and report communicable diseases, handle minor injuries such as scrapes, provide first aid, screen children daily for illnesses, notify parents that children have been exposed to infectious diseases and parasites, handle minor illnesses, such as the influenza, the flu, handle major injuries and medical emergencies, manage medication, assist with hand washing, diapering, and toileting, handle food, provide nutritious meals and snacks, respond during any disasters, care for children with special needs, care for infants, place infants to sleep on their backs, decide when children are ill, how to call for pickup, and how to care for child until family arrives. Caregivers, teachers, and others professionals in positions that have close and frequent contact with children are considered mandated reporters of abuse. The time spent with children makes caregivers likely to become aware of any maltreatment that may be occurring. You must protect the child in care from abuse, neglect, or exploitation, as required under Chapter 26.44 RCW. The law makes it very clear, when any licensed or certified child care provider or their employee has reasonable cause to believe that a child has suffered abuse or neglect, he or she shall report such incident, or cause a report to be made, to the proper law enforcement agency or to the department as provided in RCW 26.44.040. This means that when you have reason to suspect that a child is suffering from physical, sexual, or emotional abuse, neglect, or exploitation, you must immediately report the circumstances. This report must be made to Child Protective Services Central Intake. Check with your local CPS office for the exact procedures to follow if there is immediate danger to a child. If you know the child is in immediate physical danger or has been harmed and needs immediate medical attention, you must also make a report to local law enforcement. If the suspected child abuse or neglect involves you or your staff, you must inform your licensor. Once you file a report with CPS, you are immune from any civil or criminal liabilities. When you report a case of suspected child abuse, CPS has the right to interview the child in your care and look at any of your files. You can be charged with a gross misdemeanor if you do not report a suspected case of child abuse, neglect, or exploitation. So how will you know when you need to report a case of abuse or neglect? Not all acts of abuse involve physical harm to a child. Mental cruelty, threats, and failure to adequately supervise children are also types of abuse and neglect. The pamphlet, Protecting the Abused and Neglected Child, DSHS 22-163X, outlines indicators of physical abuse and neglect, emotional abuse and neglect, and sexual abuse. Your licensor can supply you with a copy of the pamphlet which offers more detailed information. Go to handout 2 for a short list of signs of abuse and neglect. If you suspect a child is a victim of abuse or neglect, what are your next steps? You must contact CPS if you even suspect that certain injuries or bruises may be accidental. You must contact CPS if you see signs of emotional or sexual abuse or physical neglect. Even if you have made a report to CPS about a particular child earlier, you must report each new injury or incident. Do not attempt to interview the child or to manage the situation yourself. Both interviewing and investigating are the responsibility of CPS. The phone number for CPS should be among the emergency numbers posted by each telephone in your program. In most circumstances, you should not inform parents you are making a CPS report. Your parent handbook or posted health policies should inform everyone that you are a mandated reporter and that you will report any suspicion of child abuse, neglect, or exploitation. Shaken baby syndrome information to help you and the families you work with. Call the Parent Trust Family Helpline at 1-800-932.HOPE, 4673. All babies cry. It's okay. Crying is one way a baby can tell you what she needs. It's normal for babies to cry 2 to 4 hours a day. Even though crying is typical, it can still be stressful. Learning how to help calm a crying baby can help you feel better. Having a plan can help you stay calm if you feel like you've tried everything and the baby is still crying. These calming activities can be part of your plan. Breathe. Take some deep breaths to help reduce feelings of anger and tension. Follow the 10-foot rule. Place the baby in a safe place and walk 10 feet away until you have calmed down. Take a break. Gently lay the baby down on his or her back and take a break. Talk to someone. It can help to share your thoughts and feelings. Go for a walk with the baby. A simple walk around the block can help calm both you and the baby. Shaking a baby can cause lasting injuries and even death. Remind yourself that you are doing the best you can. Additional resources have a plan. Shaken Baby Syndrome Prevention Brochure. Have a plan. Shaken Baby Syndrome Prevention Brochure, Spanish, have a plan. Shaken Baby Prevention Video. Have a plan. Shaken Baby Prevention Video, Spanish, have a plan. Shaken Baby Prevention Video for Teens. Child Profile. Health and safety information for parents and caregivers. Washington residents and agencies may order hard copies of the brochures by sending an email with their address and requested quantity to Strengthening Families at del.wa.gov. Presentation. Keeping children safe from harm is an important job. Think of all the ways children could potentially be injured, from burns, objects falling, entrapments, falls, weapons, loud noises, tripping, pinches, punctures, crushing injuries, cuts, etc. Your role is to remove as many hazards. Think of all the ways children could potentially be injured, from burns, objects falling, entrapments, falls, weapons, loud noises, tripping, pinches, punctures, crushing injuries, cuts, etc. Your role is to remove as many hazards as possible, exposing them to as few risks as possible. The Washington state laws, or WACs, have outlined some of these risks and have prescribed ways licensed programs must meet with safety standards. You should be aware of the requirements for the following: exits, stairs and decks, shelving and portable furniture, radon, chemicals, lead and arsenic exposure, electrical outlets, shielded light bulbs, glass doors and windows, locks, working telephone screens and windows, safe water and water play, fences and playground surfaces, ventilation and temperature requirements, animals, fish, or pets. It is impossible to memorize all of the health standards and regulations aimed at keeping children and staff out of harm's way. Use your Child Care Center licensing guidebook and FHCC guide as a reference. Work with your licensor, public health department, and fire department to stay up to date. Once a safe environment is set up, it needs to be maintained. Cleaning procedures for surfaces and equipment are spelled out for all to follow. The many things that children come in contact with should be relatively easy to clean, so avoid things that cannot be scrubbed shiny clean. Know the approved bleach/water solutions for surfaces and toys and keep a record of the cleaning schedule. Even with all precautions in place, accidents will happen, so you need to be prepared. Start with a well-supplied first aid kit for your classroom, playground, and vehicle. The list of supplies for the first aid is in your guidebook or guide. It is recommended you also make available additional disposable gloves for changing diapers or handling soiled laundry. A blood spill kit when cleaning up blood or other body fluids. Cold packs, ice cubes, or frozen sponges to reduce swelling and ease discomfort. Hand wipes. Bottled water. Each staff member must know where the first aid kit is kept. If you are going away from the center on a walk or a field trip, be sure to bring along a first aid kit. At all times, at least one staff member per group of children must have current first aid and age-appropriate CPR training. If first aid is required, stay calm. After treating an injury, remember to enter the necessary information in your accident/incident log and complete an incident report for the child's parents to sign and keep. Keep a copy of the incident report in the child's file. If an injury results where professional medical attention is required, you must notify your licensor and provide a written copy of the incident report. Note, there is a difference between an injury and an incident. The general rule is if it is an injury, a third party needs to be involved, that is, a professional. It is considered an incident if it can be handled with minor first aid applied.